Hi, everybody. My name is Dr. Adam Kittai. I'm an associate professor of medicine at the Icahn School of Medicine at Mount Sinai. Today, I have an international expert and friend of mine in CLL, Dr. Ghia. Why don't you go ahead and introduce yourself?
Hello to everyone. I'm Paolo Ghia. I'm professor of medical oncology at Università Vita-Salute San Raffaele in Milano, Italy, where I'm also directing the CLL program.
And on behalf of the CLL Society, we're going to go ahead and talk about an abstract that Dr. Ghia helped put together. The title of the abstract is called Prevalence and Clinical Impact of Clonal Hematopoiesis of Indeterminate Potential, CHIP, in Chronic Lymphocytic Leukemia and Richter Transformation. So for those patients out there that don't know what CHIP is a pre-cancerous entity that occurs before typically something called myelodysplastic syndrome and before something called acute myeloid leukemia. So it's really interesting. There's a lot of data that's being built about the presence of CHIP in society because it looks like the presence of CHIP, which is this pre-cancerous entity, can lead to associations with other malignancies, with Alzheimer's, and even cardiac disease. And so this has been a hot topic in hematology. And here in this abstract, Dr. Ghia and his investigational team studied the association between CHIP, which is not normally associated with CLL and Richter transformation. So Dr. Ghia, why don't you tell us a little bit more about this abstract?
Yes, as you mentioned, this is a complicated story somehow, meaning that we have also to remind our audience that CHIP is not only associated with myeloid neoplasm, with blood cancers, let's say, but also associated with other more general comorbidities like cardiovascular problems. So nowadays, there is a knowledge coming up that showing that CHIP can affect different aspects of our life and our illness in particular. And therefore, that was the idea, to explore how the presence of CHIP, so the presence of some mutations in genes not in CLL, might affect the CLL itself. So this was an Italian study led by Riccardo Moya from Novara. And we collected 367 patients with CLL. Some of them have been also treated with the novel therapies, and I will explain later. And the non-leukemic cells have been sequenced to see the presence of the absence of these gene mutations, typically of CHIP. And that the finding was that, as known, the mutations in these genes are more frequent in the elderly population, and typically patients with CLL are elderly, so they were frequently present. But in particular, the presence of these mutations associated with a shorter overall survival. How this happens, we don't really know, meaning that, as I said, that the presence of CHIP also associated with cardiovascular comorbidities. So maybe that affect also the life expectancy, not only due to the leukemia, but also due to other comorbidities. Interestingly enough, the presence of some of these CHIP mutations associated with atrial fibrillation in patients treated with ibrutinib. So maybe those patients who have CHIP and are treated with BTK inhibitors may be exposed more frequently to cardiovascular comorbidities and complications. And similarly, patients who had CHIP and were treated with venetoclax, they had a much more severe neutropenia, which is a typical side effect of venetoclax, but also suggested that if those neutrophils are already somehow affected by the presence of CHIP gene mutation, then they would probably more likely die in response to venetoclax and therefore show neutropenia. I just want to conclude the description of this abstract. I wanted to remind you that the association between CHIP and CLL has been already explored also in the past in a study that also we coordinated together with other friends all over Europe within ERIC, within the European Research Initiative on CLL. where we show that patients who were carrying CHIP mutations and they were treated with immunochemotherapy, in particular fludarabine, cyclophosphamide, and rituximab, those were the ones that more likely would develop acute leukemia. And we know that some patients may indeed develop acute myeloid leukemia after being treated with chemoimmunotherapy. So in this sense, we can probably identify those who should never be exposed to immunochemotherapy because they have this risk of developing secondary tumors.
Yeah, one of the interesting things I thought was in the abstract, you had showed that venetoclax treatment did not increase CHIP, and that was something that there was some concern about when venetoclax was first being developed, because we saw some increase in secondary malignancies after patients were treated with venetoclax. But it turns out most likely those increase in secondary malignancies may have been from the prior chemoimmunotherapy that they had received, which is something that we know correlates well. And two patients who might wonder, do they have CHIP, or when is this might pop up in their conversations with their physician, is right now we do next generation sequencing with various different companies or by the academic center that you're currently being seen. And this sequencing is often what finds the CHIP. So sequencing in the United States, such as with NeoGenomics or Foundation, that we use to look for a TP53 mutation, which is the classic reason why we get those tests. They also test for a whole lots of other mutations, and that's where you might find out that you have a CHIP mutation. And I know that a lot of the academic centers are currently following these patients longitudinally to see what kind of impact these CHIP mutations have on patients' lives. And so I think it's really interesting here what you found in terms of higher rates of neutropenia in patients with some of these mutations, as well as higher rates of atrial fibrillation when treated with BTK inhibitors. So it might actually have impact on the treatment choice that we make.
Yeah, absolutely. And that also has an impact much broader than blood cancer, as I mentioned, because again, it can associate with other diseases that are also life-threatening, like cardiovascular diseases. But also, if you think about other cancers, solid tumors, where again, knowing if you have CHIP or not may indeed also help use different treatment in order to avoid the possibility of occurrence of secondary malignancies, which is unfortunately a possibility after any immunochemotherapy.
Fantastic work, Dr. Ghia. Thanks for chatting with me.
Thank you very much.